Test 1, 2. So it's not tied into the system. It's tied into the amplification. So this doesn't mess up your sound. Yeah.
Thank you. And remind me.
Diana and Samantha.
Samantha's last name is
Taplin, Taplin. And my last name is spelled Tracy John, H-O-R-P-E. H-O-R-P-E.
Ready? Good morning. Good morning. I want to begin by thanking Governor Pritzker and Lieutenant Governor Stratton for joining us this morning as we work together to relieve the burden of medical debt on Cook County residents. I'm deeply grateful to you, Governor, for many things. This is just the latest. I also want to acknowledge the commissioners who are here with us today. Bill Lowry, who's chair of our Health Committee and vice chair of the board of the Health and Hospital System. Allison Sess, I should finish our commissioners. Bridget Degnan, Frank Aguilar, and Tara Stamps. I'm grateful to the commissioners who have joined us. Allison Sesso, who's president and CEO of Undue Medical Debt, has joined us. Dr. Eric Makaitis, who's CEO of Cook County Health. Ann Socorro Jackson, who's a physician assistant and senior director of advanced practice providers in Stroger Hospital Emergency Department. And Lizzie Whitehorn, who's director of healthcare and family services for the state of Illinois. Thank you all for joining us. Today, we're announcing Cook County government and the state of Illinois have now forgiven a combined total of $1.5 billion in medical debt for Cook County residents. This represents more medical debt relief than any other county in the entire country, and it reflects years of intentional, equity-driven work. And today I'm announcing something equally important about the future of this effort. Because of the substantial relief we've provided and the measurable impact we have seen, I've decided that Cook County will continue funding this program with county dollars beginning in 2027, once our federal funds are fully expended. This work has proven that targeted public investment can produce immediate, life-changing results, and we're not walking away from that success. That decision is grounded both in data and lived experience. We've seen what relief means for families across the county, and we know that the need remains. Medical debt is a quiet crisis in Cook County and across the country. It's not the result of poor choices. I'm going to say that again. It's not the result of poor choices. It's the predictable consequence of a healthcare system that too often leaves working families exposed to overwhelming costs simply for seeking care. Medical debt damages credit, limits access to housing and employment, and creates stress that worsens health outcomes. In Cook County, we decided that was unacceptable. In 2022, at the height of the COVID-19 pandemic, I launched the Medical Debt Relief Initiative grounded in a simple principle. No one should be punished for getting sick. When systems fail, government has a responsibility to act. Cook County became the first local government in the nation to use the American Rescue Plan dollars to eliminate medical debt. We made that decision intentionally. The American Rescue Plan was designed to stabilize families and prevent long-term harm. And eliminating medical debt is exactly that kind of intervention. We partnered with Undue Medical Debt, a national nonprofit with the expertise to identify and retire qualifying debt. For pennies on the dollar, we've been able to deliver real relief. There's no application, no paperwork, and no tax consequences. Residents simply receive a letter in the mail informing them that their debt has been canceled. As a result of this effort, the county's program alone has erased the medical debt for more than 630,000 people in Cook County, roughly 12% of our population. The average amount forgiven per resident is $1,300. For families living paycheck to paycheck, that relief can mean the difference between stability and crisis. This is what equity in action looks like. We know that medical debt disproportionately burdens African American and Latino communities, seniors, people with disabilities, and working families already navigating structural inequities. Eliminating this debt does not fix our healthcare system, but it does remove a significant and immediate barrier to opportunity. It restores dignity, it gives people breathing room, and it allows families to move forward. At a time when the Trump administration is stepping back from its responsibility to working families, Cook County is demonstrating what local leadership looks like: compassionate, data-driven, and fiscally responsible. This initiative delivers an extraordinary return on investment, both financially and morally. This is who we are as a county. We believe healthcare should heal. We believe government should step in when markets fail. And we believe that debt should never define a person's future. Thank you. And now it's my great pleasure to introduce the Governor of the State of Illinois, JB Pritzker.
Well, thank you very much, President Preckwinkle. Thank you for the amazing hard work and leadership that you provide for Cook County, and good morning to everyone.
Good morning.
In a healthy, functioning, and just society, no one should fall into financial ruin simply because they got sick or injured. And yet too many Illinoisans, too many Americans have been subject to that very reality. I've heard heartbreaking stories from Illinoisans of all backgrounds and zip codes, detailing the financial and emotional burden that medical debt has put on them. I've heard from young people who are unable to make major life decisions like buying a home, parents who have had to take on extra jobs, seniors who've had to forego buying their medicine just because they're struggling to pay their medical debt. People who have had their lives ruined, scraping to pay a bill that they may never be able to fully pay. People who've been pushed into bankruptcy due to a prolonged or unexpected illness. It's not fair. It's not equitable. It's not sustainable. We shouldn't have to sit here and accept it either. In Illinois, we didn't. Thanks to the efforts of people in this room, members of the General Assembly, and advocates across our state stepped up to do something about it. I want to particularly recognize the president of Cook County Board, Toni Preckwinkle. It was her idea in Cook County, and upon reading about it, we at the state level said, why are we not doing this for the rest of the state of Illinois and for people in Cook County who weren't already covered by the program? And so I called the president. She put me in touch with all the right people, and we were able to begin putting a program together, and then went to the General Assembly to make sure that we had the dollars available to get something important done. So 2 years ago, in partnership with Undo Medical Debt, Lieutenant Governor Juliana Stratton and I launched this historic medical debt relief program. And I'm proud to say that as of this month, the state of Illinois has eliminated over $1.1 billion in medical debt through that program. And of course, combined with our partners here in Cook County, who have erased $1.5 billion, we have delivered more than $2 billion in relief to over 1 million Illinoisans in all 102 counties of our state, with an average elimination across the state of $1,200 per patient. I want to thank Toni Preckwinkle. I want to thank the folks that she works with on the county board. Helping us to erase medical debt has truly meant inspiring leadership for the state and for the county. To the other individuals who are here, the organizations here with us who have been instrumental in this historic program, CEO Allison Sesso and the entire team at Undo Medical Debt, CEO Dr. Eric Makaitis and Ann Sikora Jackson of Cook County Health, the commissioners that are here, Commissioner Stamps, Commissioner Aguilar, Commissioner Lowry, my partner in governance, Lieutenant Governor Juliana Stratton, our HFS director, Lizzie Whitehorn, All of you have helped to transform so many lives, and I am so grateful for this partnership. Whether it's a car accident, a cancer diagnosis, or a life-threatening disease, navigating critical health issues is scary, and it's stressful enough. When you're worried about your own life or the life of a loved one, those who are too often struggling to make ends meet shouldn't also have massive medical debt and bills hanging over their head. Unpredictable and often unavoidable medical tragedies happen to our neighbors every single day. Anyone could be in their shoes. Countless people across the state are living proof that this program is more than clearing numbers on a ledger. It is about giving people the freedom and the opportunity to build and live their lives. Lifting the burden of medical debt restores hope. It provides a sense of security. It enables individuals to move forward free from the crushing burden of overwhelming medical debt. And with the Trump administration spending their time making healthcare more expensive and less accessible, Illinois and Cook County have stepped up to make healthcare more affordable for our people. We've seen how transformational our state and county debt elimination has been, so we plan to continue building on this work in the coming years and push this program even further. At the state level, with only $10 million in state funds, we've been able to eliminate over $1 billion in debt so far. That's more than 100 to 1 return on investment. That's what the president was talking about just a moment ago. The return on the dollars invested here are seemingly astronomical and really truly important in people's lives. One of the smartest, highest impact uses of public dollars that we can make. I've directed our state government to stretch every available dollar in this program to work on behalf of Illinoisans everywhere. So thank you. Thank you all for being here, for being part of this, for committing to a healthier, more affordable Illinois. And with that, I get to pass this podium over to an advocate and truly an incredible fighter for Illinois families, and that's Lieutenant Governor Juliana Stratton.
Good morning, everyone, and thank you, Governor, for your compassionate leadership and for understanding that affordability is not a talking point. It's the difference between stability and crisis. It's wonderful to be here with Cook County Board President Tony Preckwinkle, members of the Cook County Board of Commissioners, and the dedicated team from Cook County Health. Thank you all for your partnership. And of course, thank you to Allison Sesso for your bold and visionary efforts that have helped so many break free from the burden of medical debt. When Governor Pritzker and I took office, we were clear about our mission to deliver big things to improve the lives of Illinoisans in every corner of our state. We've never wavered from that commitment. And today is yet another example of what is possible when you believe that government can and should work for the people you represent. Over $1.1 billion of medical debt erased through the state program, and with the additional that has been erased with our Cook County partners, that's over $2 billion lifted off the shoulders of Illinoisans, giving the people we serve hope for a better future. While some in Washington dismiss affordability as a hoax, families across our state know better. Things are too expensive. Families feel it every time they open a bill, check their bank account balance, or choose between prescriptions or groceries. The problem is real, and here in Illinois, we choose to confront real problems with real solutions. The Illinois Medical Debt Relief Program is one of those solutions. In every corner of our state, there are people carrying medical debt that feels almost impossible to escape. And it can happen to any of us. A cancer diagnosis, a car accident, a chronic illness, a premature birth. Through no fault of their own, people are handed bills that can upend a lifetime of financial stability. The consequences are seen throughout our communities. It stops families from being able to buy homes. It means people can't afford to start small businesses. It limits job mobility. It delays retirement. It traps people in cycles that can last decades. That's why this program matters, and it's why Illinois and Cook County are leading the way. Because the truth is, forgiving medical debt isn't just compassionate, it's smart economic policy. When we eliminate burdensome debt, families are more likely to spend locally, invest in their homes, start businesses, and build savings, stabilizing households and entire communities. Illinois has long believed that health care is a right, but we also believe that dignity is a right, stability is a right, the opportunity to build a future is a right. And we know that medical debt disproportionately impacts working families, seniors on fixed incomes, and Black and brown communities. Addressing it is a part of building a more equitable economy. So thank you to everyone who has made this program possible. Together, we will continue to uplift Illinoisans all across the state. With that, please welcome a key partner in this effort, Allison Sesso, President and CEO of Undo Medical Debt. Thank you.
Good morning. Good morning. Thank you so much for that introduction and for being here, Lieutenant Governor, and of course to the commissioners that are here and all of the leaders. I have to say, this is what leadership and action looks like, and what partnership looks like. President Preckwinkle, you deserve so much credit, and I'm going to talk a little bit about how we've gotten here and what this has sparked across the nation because of your local and amazing leadership. And Governor, I'll just say, you're really looking at something that works and jumping right in there. And this partnership, we don't see it in the same way across the country, where a county and a state are really working together for the people. $1.5 billion of debt just here in this county, that is something that is incredible and unheard of. What the president has done is she called us up, and we were before this doing medical debt relief using donated dollars, and we were doing quite well. But she said, can we scale this? Can we use this opportunity where we have these federal dollars coming to us and do this in a larger way for the people in my county that I represent? And we said, I think we can. And we got to work. We did a lot of back and forth and figured out how to exactly apply the approach, which I will explain a little bit more, because how do you get such high return on investment? And I'll tell you a little bit about that. But what it sparked was not only was Cook County doing this, but the word got out real quick. And we now have over 25 government and state contracts across the United States. And we have gotten rid of almost $6 billion of medical debt in all those places. So I just want to say, Cook County, this is something exciting, but you're leading the nation, and those people in all those other places really have to credit President Preckwinkle for their medical debt relief as well. So a little bit about how our model works. So what we do, how do we get 1 to 100, and it's usually higher rates than that. Well, unfortunately, as it's been very well represented here today, the people who owe these debts do not have the funds to pay them. This is not an issue of moral hazard. This is not a personal failing. It is clearly a systems issue, and unfortunately, it's going in the wrong direction. Increasingly, we are expecting people to pay out of pocket way more than they actually have, and there's a huge misalignment between what those expectations are. It's preventing people from going to the doctor. It is having people sit in parking lots wondering whether or not the pain will subside, if they should walk through the doors of that ER and actually get the help that they need. It is having people cut their meds in half. There's all kinds of implications for the realities of the financial burdens that our healthcare system is putting on poor individuals. And so because of that, the debts that are owed by these people are not very valuable. The chances of collecting them are low. So in a market system, those debts have to be priced in a very depressed way. And so as a nonprofit, we take advantage of that. There is a for-profit system in which for-profit companies go and buy those debts from hospitals and other healthcare providers and then try to cut deals with people and collect on those debts. Well, we take advantage of that pricing. But instead of trying to collect on those debts, we let those people know that we have used either government dollars or donated dollars, and we are relieving them of those debts for good. So that is how our model works. That's how we're able to get this great return on investment. And we've actually applied this for a little over a decade and gotten rid of $27 billion of medical debt across the country using this model. So I'm thrilled to continue to do the work with the county and the state and to keep applying this method. But I will say that I do wish that our organization did not have to exist. Unfortunately, and I think this was mentioned earlier, we are going in the wrong direction in terms of federal policy on this. We've seen massive cuts to Medicaid programming, and we're going to see more people with more burdens and inability to access care. But this is what it looks like to do what you can from where you sit. We're doing what we can from where we sit. Do we know that we need to do better policy-wise as an organization? We understand that, and so we've invested in public policy and trying to make changes and tell the story of the individuals that are hurting on this affordability issue. But this is exactly what these leaders are doing as well. They're doing what they can from where they sit to help individuals, and also saying, and we need to have bigger, better, bolder changes that actually get people to not have this medical debt and this financial burden in the first place. So I'm thrilled to be here and to be part of this. And the CEO of Cook County Health is next to speak, and he, Dr. Mikaitis, is one that is actually living this reality and sees the patients, and his team see the patients that come in really desperate about what is this going to cost me instead of focusing on the care that they need. So I'm thrilled that you're here today and hosting us, and I'd love to invite you to speak.
Well, thank you, Allison, for that very kind introduction. Good morning, everyone.
Good morning.
Today marks a powerful milestone for the people we serve. I'm so grateful to Governor Pritzker, Lieutenant Governor Stratton, President Preckwinkle, and our Cook County Board of Commissioners. Through their leadership, Cook County and the state of Illinois have relieved an extraordinary amount of medical debt for families across our communities. This is more than a financial transaction. It's a direct investment in dignity, stability, and health. Medical debt doesn't just affect credit scores. It affects health outcomes. Patients with significant debt often delay care, skip medications, and avoid follow-up appointments. When families are burdened by debt, stress rises, chronic conditions worsen, and preventable emergencies occur. By eliminating this debt, Cook County and the state of Illinois are removing barriers to care. Most people carrying medical debt are working families, seniors, veterans, or caregivers. Many incurred bills because of unexpected illness, job loss, or gaps in coverage. Debt relief gives families breathing room. They can afford prescriptions, they can keep their housing stable, they can put food on the table, and they can seek care when they need it. We're entering a period of uncertainty as potential Medicaid cuts threaten coverage and reimbursement. Medicaid is a lifeline for millions, including half of all Cook County Health patients. Next year, as more Medicaid cuts take effect, more individuals could become uninsured. Safety net systems will face increased financial strain. Families may once again face unaffordable medical bills. Relieving debt now strengthens families before further economic pressures hit, and reduces financial vulnerability at a time when the federal health and social service programs are being weakened. This effort reflects both compassionate and foresightful leadership. As one of the nation's largest public health systems, Cook County Health has a mission rooted in caring for all, regardless of ability to pay. We see firsthand how financial hardship intersects with health inequity. Medical debt disproportionately impacts communities of color and low-income neighborhoods. Relieving this debt advances equity. It narrows gaps created by systemic barriers. And it sends a message: healthcare should heal, not financially harm. I'd again like to thank Governor Pritzker, Lieutenant Governor Stratton, and President Preckwinkle. This progress is possible because of strong collaboration between state and local government. When we work together with shared purpose, we can tackle urgent challenges like medical debt and deliver real relief to the people we serve. Thank you again for joining us today, and it's now my pleasure to invite Ann Sikora Jackson, Senior Director of Advanced Practice Providers, to the podium.
Thank you, Dr. Mikaitis, and good morning, everyone.
Good morning.
My name is Ann Sikora Jackson, and I am the Senior Director of Advanced Practice Providers here at Cook County Health. And as a physician assistant, I also care for patients in the Stroger Emergency Department. Every day, my colleagues and I see patients at their most vulnerable. But the vulnerability we see is not only physical, it is financial. We see it in the eyes of a mother who hesitates in accepting an ultrasound, or a senior who asks how much a life-saving prescription will cost before they even ask about the side effects. patients who feel that they need to limit their medical care for the fear of cost savings and asking whether or not a simple x-ray can be done instead of an MRI scan. We are the ones that see the heartbreaking trend of patients waiting out their symptoms because they are terrified of the bill. Too often, by the time they come to us at Cook County Health, a manageable condition has often become a crisis. And I've seen this firsthand in the emergency department, working in our triage Dr. Quick area, where patients come in pain, but the first thing they ask is, will you see me because I don't have insurance and I don't have money. I've cared for patients who have ignored chest pains for days or skipped insulin doses because they were still paying off a debt from 3 years prior. It's not just emergent care. We regularly see patients skip routine checkups because they are afraid of the expense. We see families that are self-triaging within their own family if there are multiple patients and family members who are ill. Who will go to the doctor today? When you have to choose between your family members or rent for a checkup, your health almost always loses. The medical debt relief announced by Governor Pritzker and President Preckwinkle today is quite literally a life-saving intervention. It removes the cost barriers that keep patients from seeking additional medical care. I want to thank President Preckwinkle, Governor Pritzker, and Lieutenant Governor Stratton for recognizing that health care is a right, not a privilege for those who can afford to pay for it. Thank you.
Thank you. I'd like to thank all of our speakers for joining us, and Diana Thorpe and Samantha Taplin, who are our sign language interpreters. Thank you. Yes. Sure.